now is Mr. Matthew Feshbach. He is the CEO and founder of Okyanos, and Okyanos means basically a Greek thing for what? Give me a help for that one.
Okyanos is the Greek river god, and it symbolizes restoring blood flow.
There you go. I knew it had something, but I just couldn't figure out what the last piece was.
No problem.
What we're looking at today is stem cells and use of stem cells, but the idea behind it is this company that you formed really looks at it in a different way. We have lots of different thought patterns on stem cells, where they come from and how we use them, but in your world, we're doing it a little differently. You kind of built this up from the bottom, and there's some history behind it. Tell us a little bit about why you started the company you did.
Well, I actually am an investment guy,
Mm-hmm.
or I guess I should say a reformed investment guy.
Mm-hmm.
And I made an investment in a company that's the leader in technology for separating stem cells from body fat.
Okay.
And without getting into too much biology, stem cells are more accessible, abundant, and potent in your body fat. Adult stem cells, your own adult stem cells. So I got very intrigued as an investor as to what these cells could do. The biology just fascinated me because it seemed like it was kind of an unlimited potential. And at one day I had one of these epiphanies, and I realized that it's the next phase in the evolution of medicine. That first we had surgery, then drugs, then devices, but now people can be treated with their own adult stem cells and help to resolve or even cure, in some cases, certain chronic diseases.
So if we talk about diseases, there's always a common denominator on most everything. And we look at these as roles of how we fix these things. Underlying for most chronic disease is going to be some sort of inflammation. So tell us a little bit about the stem cells' role. What do you think they're supposed to do? What does research show us to do? And what are your outcomes from those?
Well, that's a great question. So there are 5 key mechanisms of adult stem cells. So if you compare these adult stem cells to embryonic, well, embryonic are cells that differentiate. See, a stem cell is a blank slate. So then they have to differentiate and become the cells that make up our blood, tissues, nerves. So those are what embryonic stem cells do. But adult stem cells, which are in every tissue of your body, they're in your skin, your eyes, your teeth, your bone marrow, but most abundantly in your fat, they're supposed to repair your body. And they do it in 5 simple ways. One is they differentiate into tissue. So if we put these stem cells in somebody's knee, they can grow new cartilage. And we have patients who came in, probably 40 patients who have come in and said, I want to avoid knee replacement. I've been prescribed knee replacement. We put the stem cells in their knee. I'm oversimplifying. And we have not had one patient go for knee replacement. So that's the first thing they do. And I could show you before and afters of new cartilage being grown, or before and afters of new bone being grown when a fracture doesn't fully heal. But then, back to the inflammation. Virtually every chronic disease but cancer and genetic disorders involve inflammation. And in fact, many people think it's the beginning. It causes most disease. Well, these cells are incredibly anti-inflammatory. So sometimes, but not always, we'll get remarkable results with patients who have an inflammatory disease. Like we had a guy, very prominent OBGYN doctor from the UK, who had a bad disease where his nerves were basically degenerating in his legs, and he'd been in a wheelchair for 2 years. We put the cells into his legs, and we did an IV of cells, and he was out of his wheelchair. Why? Because they're so anti-inflammatory. For you to believe it's a sustainable result, you got to look at 6 months. It's a little too good to be true. We take everybody out of their wheelchair. I'm not saying that, but we have taken a number of people out of their wheelchair, and they've been able to stay out because the cells then also rebalance the immune system. They restore blood flow. That's why we call it Okyanos. And they actually will reverse scar. And so when you combine those things, scar, lack of blood flow, inflammation, immune response, and degeneration of tissue, that's involved in almost every chronic disease, whether it's your heart or your knees or your brain.
So when we look at a lot of the studies, they don't do full body. They really look more at the specifics because it's easier to study in individual pieces. There's been studies on pretty much everything. I've seen recent studies on hearts where they're starting to see stem cells being involved in that to have resolution and repair from heart attacks, CHF, things along those lines. And then obviously the different pieces, we're going to play with this for a while. Your program really doesn't make stem cells. It makes it so the stem cells are better harvested, separated. What's the trick there?
That's exactly right. So we are using a technology that's approved in Japan, Europe, China, Singapore, Australia, just not the United States. But that technology, and they are in an approval pathway here, so that technology gets you the highest yield of stem cells with the most viability. So we can really bring a therapeutic dose to a patient, and it's their own stem cells. So you do it in the same day procedure. Takes about 5 hours, and whether we inject in the wall of the heart or put them in the knee or do an IV for something like an autoimmune condition or a combination of those, that's what we do that's unique. We have the best technology, the best protocols, and we built a small hospital in the Bahamas.
Okay. So looking at all these things, all these lots of research, lots of pieces, you're just putting into theory, what theory is, putting it into work every day. So you're not reinventing, you're making things that are already there better.
Right. There have been hundreds of trials, and literally there could be 15,000 scientific papers that support what we do. But that doesn't mean that there isn't a lot more research and that it is in early days. But we do know one thing. We know it's safe. We know that we can do this and that there's never been what they call a cell-related adverse event using the technology that we use.
And since it's from the patient shouldn't reject it, so that should work out well. So obviously a very interesting environment. We're looking at adipose tissue. For some of us, there's more of it, so obviously there should be more cells in there as well. We're not using embryonic ones, so we look at these as a kind of a wave of the future. So I'm very excited about your company. It sounds very interesting. Thank you so much for sharing with us today.
Thank you for having me.